So we're in ultrasound right now, just to give you a little heads up on what it would be like if you were to be called back for an ultrasound after your mammogram. And Martha's going to explain a little bit of what kind of probe they use and what happens when you come in for your ultrasound after your mammogram.
All right, I'm Melanie, Mammomamas, and this is Miss Martha.
Hello.
And she's an awesome ultrasonographer.
Yes.
Correct?
Yep.
Very good. And so how long do you have to go to school to be an ultrasound tech?
2 years, just like it would for any x-ray, or I don't know if mammo's the same, but it is 2 years, and it's an exciting 2 years.
Very good. And did you just do ultrasound only, or did you do x-ray too?
Only ultrasound.
Okay. All right, cool. So what happens a lot of times is when you get called back for your follow-up mammogram, we also include an ultrasound with that. And so we want to show you what an ultrasound looks like, and it doesn't hurt at all. So what she did was she put some gel on there.
This is just some goopy gel that we use. This is one of our standard probes that we use. It's a little wider, so we can actually see a lot more of the breast tissue. And I'm just going to give a little example on Mel's hand. This is our screen right here. This is what you normally see, and half the time we'll be playing around with the knobs. So you shouldn't be nervous at all. We're just adjusting everything for our ultrasound.
So it's just a little cold, is all, and gooey.
And you'll just see the gray, and sometimes we'll be able to explain what we're looking at. If it's, you know, this is her hand, so these are her bones right here. If it was breast, it'd just be gray and white, and you'll see the tissues and all of that stuff. So you shouldn't be scared when you see this. And half the time when you do ask your ultrasound tech any questions, they're not able to answer right away because the doctor has to look at the images. But
because we're not doctors,
yes,
we're x-ray techs.
And a lot of times mammography and ultrasound work really close together, right?
Yes, very close. That way we know what we're looking at and we're pinpointing everything that we need.
So how is ultrasound different than mammography? I mean, what does ultrasound show different? Like different kinds of tumors, or?
Different kinds of tumors. We can actually detail the tumors, see the margins, measure it, put what we call color flow, which is basically if there's any veins or arteries going into whatever we're looking at.
And what I understand is that ultrasound shows things that are like fluid filled rather than solid filled, rather than like calcifications. It's something else we're going to be showing you guys later, is calcifications. And those are not seen on ultrasound, or are they?
Sometimes they are. If it's a mass that we can really see, a good mass, there's sometimes little specks of white inside, and that's usually what calcifications look like for us. And cysts are just pure black, is what it looks like to us.
And are cysts dangerous, or?
Cysts are usually benign. Usually they go away or rupture, and then your body just absorbs them. Or they stay and they kind of shrink and then come back. So usually sometimes during your menstrual cycle that happens, or if you have a lot of estrogen.
Okay, and again, we're not doctors, we're just x-ray techs, and we're just talking to you about experiences that we have and questions that patients ask us. And we've done a lot of research on it, but we are not physicians. But we're just trying to help you understand from our perspective, like how this all works.
Well, thanks, guys.
All right.
Very good for the site.
Talk to you later.